Right now on 12 on Health, relief for back pain. We're covering everything from basic back-saving tips to high-tech surgery.
Hello, everyone. Welcome to this edition of 12 on Health. You're watching News 12 Connecticut, as local news gets. Now, do you know what topic gets the most response on 12 on Health? I was just telling our doc here. Back pain. It is interfering with millions of people's lives, and lots of people are just ignoring the start of the pain amid the holiday hoopla. So let's get right to some of the things you can do to steer clear of back pain, especially if you know you're prone to it. Neurosurgeon Dr. Jack Stern is here from the White Plains-based Brain and Spine Surgeons of New York, and Dr. Stern has been named one of New York Magazine's top docs for the 8th year in a row. Congratulations, Doc.
Thanks very much.
Holiday stress, and that's combining with, does the cold weather add to the problem?
I think what adds to the problem is we're suddenly in a frenzy over the holidays, trying to get everything done, trying to get it done quickly, whether it's shopping or getting our homes prepared or raking the leaves. So we
quickly lifting something.
We tend to ignore our bodies in the rush to get things done and forget some of the basic needs that our bodies have, particularly our backs, to keep ourselves healthy and keep ourselves in shape for the holiday season.
Isn't that the truth? A friend of mine who has a bad back and a bad hip, she got through Thanksgiving and then she couldn't move the next day. It's almost like she used adrenaline to get through that last day.
Yeah, well, I usually can't get through Thanksgiving because I've eaten too much. My back seems to be pretty good, but it's a combination of eating, drinking, not taking care of yourself.
On that first sign of back pain, what should someone do?
I think the first thing that someone does is just think about it. What have you done? How bad is it? Have I had it before? If I've had it before, what's helped me get rid of it?
And think through what you just lifted or what motion you just made.
Right, clearly, because most back pain is very much self-limiting. If you're really clever and you pay attention to what you did, relax for a little bit, maybe take some anti-inflammatories, and if it's really severe, ice it for a while. Think of it as if it were an athletic injury.
And why? Describe what goes on when you ice that injury.
What happens when you ice that injury is that you really get lots of blood to the muscles, and the swelling goes down. And when the swelling goes down, those muscles feel a lot better. And
when folks ice an injury, I want to get very specific about this. You might not think of your bad back as an injury, but it is what you're saying.
No question.
And ice packs on the back, but also, would you agree that icing some paper cups of water and then having someone rub that on your back would be good? Because I know a physical therapist who recommends that.
I think the best thing and the easiest thing at home is to get a Ziploc bag, fill it with ice, and put it on your back. And I think the key is because it's painful, is to keep it on there till the pain of the ice goes away, and then keep it on there for another 30 seconds to a minute. That's when it really works.
And at that time, it will shrink down that inflamed tissue?
Right.
And give you relief?
Hopefully.
Yes.
Yeah.
What can folks keep in mind in terms of prevention?
Couple of things. Number one, be thoughtful. If you know you're going to do an activity, say it's the season where you rake leaves, it's the season where you go out and shovel snow,
which we're anticipating.
Correct, this week. Dress appropriately. Think of it again as an athletic activity. Hydrate yourself. Rest between the activities. So don't be out there like a weekend warrior and decide that you're going to shovel all the snow.
Yeah. And sometimes it gets quite high. This is from last season, but you could see how he's bending over, just like boom.
Right.
Do you bend at the knees for this too? I know you docs are always saying bend at the knees.
Yeah, if you can. This old fellow over there looked like he couldn't bend at the knees.
I know, but maybe he shouldn't be out there.
I would suspect that probably somebody else should be out there.
Call up the neighbor or something.
Hire a kid. Right.
Open the wallet.
Yeah.
Okay. And in terms of stress, how come stress can cause trouble with your back?
You know, that's a really interesting question. I've never been clear about it myself, even though clearly I've manifested back pain when I'm stressed. I think we just develop some spasm when it's a flight and reaction, and
Yes.
we tense up, and the muscles all tense up. And I think a combination of that and the combination of doing too much and not thinking about our backs probably is a combination that really leads to back pain.
And one last thing, is it good to baby your back if you're feeling a little bit of pain, lay down, or keep moving and just keep it limited?
Yeah. If you ask physical therapists who deal with it really more than I do, most of them will tell you, keep some activity going. And when you lie down and do nothing, unless, of course, you're in so much pain that you can't do anything, but for most of us, we develop back pain, the best is to actually stretch. Get on the floor, do the back exercises, or learn the back exercises, and do the stretching. And it's a much better regimen than doing nothing.
Stretching at the start of the day and midway as well?
Absolutely. I mean, in terms of knowing that you're going to go out and do an activity that's going to potentially hurt your back, stretch before you go out.
And driving. Is driving an issue? I mean, staying seated for an extended period?
Definitely. For someone who knows that, when I get into my wife's car, I get back pain. There's clearly, and it's not psychological. It has nothing to do with my wife, I promise.
There, but it did occur to me.
When I sit in her car, there's something about that car seat that hurts my back. I get into my own car, and it's fine. So there's something mechanical about that seat that bothers me.
Okay, switch cars, listen to your body.
Drive my own car.
All right, thank you so much, Dr. Stern.